Whether playing in one's backyard or on a court, it is like a case of been there done that for most of us when it comes to common sports injuries. Pulled muscles to broken bones. There can be simple practices one can adopt to evade injuries while being engaged in sports. Avoiding most common sports injuries. Here address the most common sports injuries and how to lessen the likelihood of getting injured. Eye injuries. People of all ages are prone to ocular sports injuries regardless of what kind of sport one is engaged in. Primarily, one is vulnerable to blunt trauma, penetrative or radiation-related eye injuries in sports. Yet, according to Desmond and Optum, 90% of eye injuries and marks are preventable. The easiest way to avoid eye injuries is by wearing protective eyewear. Polycarbonate lenses, 3mm, are considered the best in sports by the American Academy of Family Physicians because they are thinnest and impact-resistant. Sprains and strains. When a ligament near a joint gets torn or stretched, it is known as a sprain. And, when the same happens to a tendon or a muscle, it results in a strain. Symptoms are the same in both cases: pain, swelling, trouble moving, bruising, and inability to apply weight to the affected joint. For prevention, practice safe workouts, using appropriate equipment, including shoes and clothing, and warm-up exercises are the best measures one can take. And if it happens, it is essential to rest and keep a mental note that a doctor would be best suited to differentiate the two and suggest anti-inflammatory medications. Dislocation and fractures. Dislocations occur when ends of bones are forced out of position. Mayo Clinic further warns that one is likely to dislocate again once it happens. While in fractures, bones may break from any point, often due to acute application of force. Extreme pain, swelling, numbness, immobilization, and deformity happen in both cases. The top prevention tip is to use suggested protective gears according to the type of sports. Stability and strength exercises are highly recommended to prevent future dislocations and fractures. Abrasions, cuts, and lacerations. Different names refer to such injuries as scrapes, friction burns, grazes and road rashes, etc. These are typically caused by a fall on rough surfaces, and wearing off the skin generally occurs. Minor bleeding, draining, and pain are commonly associated with such injuries. If not dealt with appropriately, rinsing, topical antibiotic application and bandages, etc., a wrong judgment in such damages can result in severe infection or scarring later. Researchers recommend these critical points for practicing prevention: learning proper form, forcing safety habits and rules, staying within one's skill/weight limits, without putting undue pressure to achieve something impossible. It is clear that safety equipment and precautions are very influential in reducing the risks and prevention of most common sports injuries.